CPSO presents In Dialogue, a podcast series where we speak to health system experts on issues related to medical regulation, the delivery of quality care, physician wellness, and initiatives to address bias and discrimination in healthcare.
My name is Dr. Saroo Sharda. I'm a practicing anesthesiologist, in addition to my roles as a medical advisor and equity, diversity, inclusion lead at the CPSO.
Welcome. Thank you for joining us for another episode of In Dialogue. And I am so thrilled to be hosting this episode during Pride Month. As I hope that you know, at CPSO, we stand with our health system partners in celebrating the contributions and accomplishments of Ontario's 2S LGBTQIA+ physicians and health leaders. And I'm very excited to be joined by one of those leaders today, Dr. Jordan Goodridge. Hi, Jordan. Thank you so much for being with us.
Hi, thank you so much for having me. It's my pleasure being here today.
Jordan, you do a variety of work in this space, and I know that you wear lots of different hats and have been involved in lots of different organizations. Can you tell us just a little bit about some of that work, and then we'll dive in deeper to kind of find out in depth more about some of those pieces?
Absolutely. So my training is in family medicine, but I also completed an HIV enhanced skills program year with the University of Toronto. So a lot of the work that I do centers around HIV care, 2S LGBTQ health, and I've done that in a number of different ways so far over my career, which I'd like to think is still relatively early on. So I've worked with the Sherbourne Health Centre here in downtown Toronto on the 2S LGBTQ health team. So the clients that we see generally all fall under that umbrella, at least within the team that I primarily work on. And that's where I've worked as a family physician for slightly over 4 years. Right now, I've transitioned into more of kind of a consulting role in terms of providing HIV consults and doing transition-related surgery assessments to kind of help support some of my colleagues at the Sherbourne Health Centre. I also do work with Rainbow Health Ontario, as well as the CAMH, Centre for Addictions and Mental Health here in Toronto, doing lots of educational work to other working staff physicians, residents, nursing students, nurse practitioners, etc., just in terms of providing transgender and gender-affirming healthcare. And finally, I also am a faculty member at the University of Toronto, where I'm currently a course director, and I do a lot of teaching there as well to the medical students, largely around 2S LGBTQ health, HIV care, and a few different areas as well.
You're busy, Jordan. Busy with things that clearly, are a passion of yours and so important to the way that we provide safe and inclusive and culturally safe healthcare. I wonder if we can talk a little bit about HIV care to begin with. Mm-hmm. Can you explain to us what you have found to be some of the specific issues and barriers to care that are faced by patients with HIV? What has kind of been, I guess, A, your experience of that as a physician providing care, and B, some of the important lessons that you've learned from that maybe you want to share with others?
Absolutely, yeah. So I find that patients with HIV can face a number of barriers to accessing care. But I think one of the main messages that I want to convey today is that each patient is completely different, and each of their barriers, each of their kind of goals for care can differ depending on a number of factors that may actually be unrelated to their HIV. So, for instance, we know certain populations that are already disenfranchised are at a higher risk of HIV transmission and acquisition. We know, for instance, Black, Indigenous, and other people of color, as well as sexual and gender minorities, such as the transgender community, men who have sex with men, are disproportionately affected by HIV. And so while HIV in itself can act as a stigmatizing diagnosis, can affect how individuals interact with their world and interact with their healthcare providers, there are a lot of other intersecting factors as well that actually can affect their engagement in care and present as barriers to care. So that's one of the main messages I want to convey, is not forgetting about all of those different identities that any given patient might have, and how that can play out in terms of their care. So for instance, knowing that, let's say, Black transgender individuals are at a higher risk of HIV, but being Black and being transgender can affect how they interact and engage with the healthcare system, right? We recognize that we have worked in historically oppressive systems, and that can absolutely influence the ways that patients do or don't choose to engage in care. So I think first and foremost, recognizing all of those factors, doing reflection on what our own biases are, kind of working in a system that's been, historically oppressive, and then recognizing how we can intervene to best help support our patients, which isn't a one-size-fits-all approach, but actually rather has to be quite individualized.
And what I'm hearing from you is it's making me think about these ideas of cultural humility and being curious and not kind of thinking about any marginalized group as a monolithic group of people, right? Like we all have these intersectional experiences. And perhaps I think where we sometimes struggle as healthcare providers is that we do consciously or unconsciously start to group people together, and then that kind of ends up leading to certain stereotypes, which then affect the way we interact and the way we provide care. So I think it's that balance, right, that we're always looking for, of recognizing that there are these systems of oppression that affect certain groups of people, and that cannot be ignored. And then there's also the individual within that system who has all of their own experiences and life experiences and the way that the healthcare system has treated them in the past that they're then bringing to that interaction. So maybe a follow-up question then is, in your team at Sherborne or all the other places that you work at, what kind of things do you do to help patients or clients feel safe and confident in sharing questions, concerns that maybe they haven't been able to bring to other providers? What are some of the things that you do, recognizing that not everybody has access to a place like Sherborne, right? Particularly, I'm thinking about patients in more rural communities. So how can we as healthcare providers think about some of that framing in helping people feel safe coming to us with their questions and their concerns?
Absolutely. Yeah, I think first and foremost is just making sure that your healthcare environment is one that's inclusive of individuals from many different identities. So thinking about the pamphlets and brochures and posters you may have in your waiting room, are the images there presented of individuals from diverse backgrounds, right? Do you have representation of 2S LGBTQ identities, of Black, Indigenous, and other people of color, of different kind of family structures? Because I think a lot of the time what happens is we don't recognize, the ways in which a lot of these resources can be presented in a more kind of heteronormative, cisnormative framework. And so thinking, do I have signages up in my clinic that demonstrate to these populations that, we are aware that they exist and we want to help? Do we have gender neutral bathrooms that can help patients to feel more included in their space? Does the intake form that we use for a clinic or in the hospital actually allow patients to identify their own gender rather than circling the binary male or female? So there's a lot of things that even before a patient sees their healthcare provider, a lot of cues in their environment that will tell them whether or not they can let their guard down a little bit, whether or not they might feel safe. And then we try to reduce the barriers of care as much as possible. I am very fortunate to have training in HIV primary care and to work at Sherborne, really a center of excellence in providing 2S LGBTQ care. But I recognize that actually as healthcare providers might not have received a ton of training in these areas. So I think one of the ways that we can help to address these barriers is reducing as much as possible the kind of burden of care that falls on the patient, whether that's having to see a ton of specialists for conditions that potentially could be managed by their family physician. I think one of the real benefits of antiretroviral therapy, of HIV therapy, improving so much over the years is that we have treatments that are easier to continue patients on, that have less adverse effects or consequences to their health over the long term. A lot of primary care physicians can actually continue patients on. And so, even just reducing the number of times that patients have to go to a specifically labeled HIV clinic, which actually may in itself be stigmatizing to the patient, that even in and of itself is a great way to help reduce barriers to our patients.
Yeah, those are really, really helpful, Jordan, because not only are you talking about sort of unpacking our own biases and thinking about some of the ways that we may consciously or unconsciously kind of uphold systems of oppression, but you're also giving us really practical examples. And actually, what you're saying about space really resonates for me, because we did a CPSO dialogue article on this, which we'll link, which was about how do you create these kinds of safe, inclusive spaces. And I think it was specifically at that time talking about trans patients or people who identify as trans, but certainly some of those principles are the same. And I was just thinking about, my own personal biases and the fact that I've had to be really intentional when talking to my kids, because, we're a pretty heteronormative family. Of course, we have friends who are queer, but being really intentional about what kind of books am I choosing for my kids to read? Are they representing different kinds of family structures? Because it's very easy not to think about that, right? And so I think I'm using that example as, being unaware of this doesn't necessarily make us bad people. I think we often go to this good and bad binary and when we talk about equity work too, right? It's really just about being intentional about, of course I have biases. Of course I'm going to uphold these things without realizing, and how do I become intentional about that? So thank you for that. I wanted to expand a little bit on something you said near the end of that answer, which is that you've had the opportunity to do specific training. You work at this center of excellence. You have a whole team of people around you. What about folks, and I'm thinking specifically maybe now about people who provide primary care in communities who don't necessarily have access to that? They don't have access to a Dr. Goodridge or a Sherborne or what kind of advice would you give to them? What kind of advice have you given as a mentor and an educator, let's say with Rainbow Health, to people like that, or even to institutions who are trying but maybe struggling with some of this and trying to understand how they bring this into their own practices and their own institutions?
Mm-hmm. Yes, that's an excellent question. Coming from the perspective of 2S LGBTQ inclusive care, I really, really appreciate Rainbow Health Ontario as an organization in general. So Rainbow Health Ontario, or RHO, has a number of different training courses that are available to physicians, whether it be primary care physicians, specialists, as well as healthcare providers from other fields as well, that are really designed to help make sure that providers have at least a baseline in terms of kind of cultural competence and understanding how to provide cultural safety to these clients. The good news too with the Rainbow Health Ontario courses is that they are CME accredited. So for instance, for those family physicians who have to complete a certain number of main pro credits anyways, it's a really great way to do so, as well as to learn about this type of care and to really benefit the care that you're providing to all patients, right? Those who are out as 2S LGBTQ and those who are not. So I really recommend that as a resource. Rainbow Health Ontario provides a number of sessions, both in terms of how to provide hormone therapy to patients, what details to counsel patients on when prescribing, how to refer for transition-related surgeries. And so basically, I think that, this is one of the ways that providers can help to fill that gap that they identify they might have as a result of not having learned or seen so many patients from these populations during their own training. There are some other resources as well, and I'm happy to say that overall the number of resources have been increasing over the years. So for instance, the Centers of Addiction and Mental Health, or CAMH, does also offer a program called the ECHO program. And a lot of different training courses are available through ECHO for, again, physicians as well as other interdisciplinary healthcare providers. And one of their programs is the Transgender and Gender Diverse ECHO program. So I'd recommend individuals who are interested in learning more about 2S LGBTQ health to check out, for instance, one of those resources. Those are probably some of the main resources. And then when it comes to HIV primary care, I recognize that that's something that may be a bit more difficult when you're no longer in your training to feel like you can get knowledge and expertise on. There are a lot of great conferences on HIV care that help to update physicians about the most recent advances in antiretroviral therapy. So I'd encourage physicians to check those out to see what antiretroviral therapies are really now recommended, get information about their safety, their efficacy. And I think one of the things that people will recognize is that HIV medications and prescribing them are no longer something to fear as much as